Hi there, thanks very much for joining us today. As you can see, Jason is with me and he'll help me with questions from the media later on. But first of all, let me just give you an update on the situation, starting with today's figures. 950 positive cases were reported yesterday. That's 3.5% of the tests that were carried out yesterday, and the total number of confirmed cases now stands at 251,911. There are 128 people currently in hospital. That's 12 fewer than the position yesterday, and 12 people are receiving intensive care just now, and that's no change on the position yesterday. Sadly, 2 additional deaths have been reported, and that means the total number of deaths is now 7,690. That's the total number under this daily measurement that we report against. And as always, my condolences are with everyone who has lost someone. I'll also give you an update on the vaccination programme. As of this morning, 3,591,638 people have received a first dose of the vaccine. That is an increase of 19,912 since yesterday. In addition to that, 19,737 people got a second dose yesterday, and that brings the total number of second doses that have been administered now to 2,535,803. So as you can see, the vaccination programme continues to go extremely well. More than 3/4 of all people over the age of 40 have now received both doses of the vaccine. And that figure includes some quite exceptional coverage rates amongst older age groups who, of course, at an earlier stage were prioritised for vaccination. So, for example, more than 97% of everybody over the age of 60 has now received both doses of the vaccine. As I indicated in Parliament earlier this week, all second dose appointments will now be scheduled for 8 weeks after someone's first vaccination rather than 12 weeks as before. That's a really important step forward because second doses, we know, and all of the developing evidence tells us this, are really important in providing significant protection against the virus, and in particular against the current Delta strain that is circulating so widely. As well as accelerating the provision of second doses, though, we're also making really rapid progress on first doses for younger age groups. Already I can tell you that more than 70% of 30 to 39-year-olds and also 1/3 of 18 to 29-year-olds have received a first dose of vaccine. And I can confirm today, again, I indicated that we hoped this would be the case earlier in the week, but I can confirm that the scheduling of appointments for first doses for all 18 to 29-year-olds is now complete. So everyone in that age group, if you haven't already, will have received notification of an appointment by the end of next week. If you're aged 18 to 29 and you haven't had an appointment sent to you by next weekend, please go to the appointment checker page on the NHS Inform website so that you can make sure that you get an appointment arranged. And you can also use the NHS Inform website if you need to rearrange your appointment. And please, this is a message I want to stress today, please do rearrange if you're not able to make the appointment sent to you. We understand that particularly in the younger age groups, people are working, so there may be more who just can't make the first appointment that is sent to them. Don't let that mean that you don't get vaccinated. Please go onto the website and make an alternative appointment. Vaccines are the way back to normality. I think we are increasingly confident of that. And literally, quite literally, every single one of us who gets these jags is representing a step back towards normal life. Now, we had indicated, and we have indicated all along up until now, that we expected to have offered first doses to all adults by the end of July. Now, I've just said that all appointments for all adults should be with people by the end of next week. So you can see that the programme is going faster than we previously anticipated. And I'm also pleased to confirm that we now expect to have completed first doses for all adults by the 18th of July. So again, faster progress than we thought might be possible just even a few weeks ago. And I want to convey my thanks to everyone working hard to make that possible. Of course, everyone is working just as hard to get second doses administered as quickly as possible. And again, let me stress, getting 2 doses gives substantially more protection than just 1 dose. So please come forward to get your second dose just as soon as you're called. I'm personally looking forward to getting my own second dose on Monday morning next week. It is this progress with vaccination that gives us real hope and really significant hope that despite the big increase in cases we've been seeing recently, driven by the Delta variant, we will still be able, albeit we've had to pause a bit at the moment, but that we will still be able over the course of the summer to ease restrictions further and get back to much greater normality. As I've discussed before, vaccinations do now seem to be weakening the link between a rise in new cases and a rise in hospitalisations and people dying from the virus. Public Health Scotland published some information this week showing that in February about 13% of all positive cases ended up in hospital. By the time we got to the end of May, that was down to 5%. So we can see the effect and the impact that vaccines are having. The link has weakened. It hasn't yet completely broken because there is still a sizable proportion of the population not yet fully vaccinated, which is why, as I indicated in Parliament on Tuesday, we are taking at the moment a bit of a pause in our route map. It is unlikely, although I'll confirm this in Parliament next Tuesday, but it's unlikely that we will move any part of the country down a level at the next review point. It's really important in this race we're in between the virus and the vaccine that we do the vaccination as quickly as possible, but that we don't allow the virus to get ahead of it. And at points that must mean taking action to slow the virus down as much as we can. So as I said, I'll give a further update to Parliament on Tuesday, and at that time we'll also publish a revised strategic framework which will set out our aims for moving beyond level 0 as soon as we can and returning towards normality just as soon as possible. For today though, before I finish, there's 3 points I want to briefly highlight. Firstly, just to give an indication that we're introducing to Parliament today legislation that will extend by 6 months some of the emergency measures we had to introduce because of the pandemic. These measures include changes to how the courts operate and additional safeguards to protect tenants from eviction. However, we're also allowing some of the emergency regulations to expire. For example, some temporary measures on marriages and civil partnerships are no longer needed now that registration offices are open again. The legislation therefore recognises that although we are in that journey back to normality, and therefore some measures are no longer needed, we're not quite there yet. So we need to keep some of these in place for a bit longer. The second point I want to highlight is around travel. As you know, we continue to keep travel restrictions under review, and I can confirm some changes that will come into effect over the weekend. From today, current restrictions on travel between Scotland and Bedford will be lifted, so non-essential travel to and from Bedford is permitted again. We've also now lifted restrictions on travel between Scotland and the Republic of Ireland. Again, that means non-essential travel is no longer prohibited. However, anyone planning to travel to the Republic of Ireland should note that under Ireland's current rules, you will be required to self-isolate when you arrive there. I regret, however, that we are introducing restrictions on travel between Scotland and 2 cities in England. Manchester and Salford currently have high levels of COVID, and so from Monday onwards, non-essential travel between Scotland and those cities is not permitted. Non-essential travel is already prohibited between Scotland and Bolton and Blackburn with Darwin. So anyone travelling elsewhere in the Greater Manchester or Lancashire area, I'd ask to think carefully about whether your journey is really necessary, because we do see cases rising across that region. Now, I realise that for those with family or friends in Manchester or Salford, or for anyone who was simply planning a visit, this is disappointing. But rates of COVID in these cities are particularly high at the moment, and these restrictions are intended to minimise the risk of either exacerbating the situation there or indeed allowing more virus to come back here to Scotland. The third point I want to highlight is about the main talking point for most people over the course of today, I would imagine, which is the football later this evening. The Scotland-England game at Wembley tonight will be a great occasion, or at least we hope it will be a great occasion. And let me just briefly take this opportunity to wish Steve Clarke, Andy Robertson and the whole of the Scotland team the very, very best of luck for that match tonight. The whole country will be cheering you on. It's only natural that many of us want to watch this game with friends. You know, that sense of being in a shared experience is one of the many things that make watching our national team so special. But please, and you know, I don't relish being the one that has to keep saying this, but I have a duty to keep saying this. Please remember, if you're watching the match tonight, continue to take care. In particular, if you're gathering inside your own house or somebody else's house, please stick to the limits. And that at the moment is 6 people from 3 households. And the point of these limits is to try to restrict spread of the virus, because indoors we know is much higher risk than outdoors. And please remember to take the basic precautions. Keep the windows open, wash your hands regularly, and please be especially careful around people who aren't yet fully vaccinated or who might be more vulnerable. And even be careful if, or hopefully when, Scotland score some goals. I know these precautions are tiresome for everybody in every context, and they're particularly tiresome when people are trying to enjoy the normal pleasures of a football match. But this virus, it doesn't care about football. It's not a Scotland fan or an England fan. It only cares about spreading from one person to another. So all of us still have to work hard to try to deny it, as far as we can, the opportunities to spread. And that basic message that we all still need to take care continues to be really important. As I said a moment ago, this is a race between vaccines that are getting us out of this and the virus. Unfortunately, this is a virus that keeps learning to run faster. So we have an obligation and a need to continue to slow it down while that vaccination programme continues to power ahead. So I'll end just briefly by stressing the three key things that if we all do, we're going to really help achieve that. The first is vaccination. I cannot stress enough how important it is to get vaccinated when you have the chance, not just your first dose, but your second dose as well. Every single one of us that rolls up our sleeve, gets these jags, is personally playing a part in getting us back to normal. The vaccines are working well, we know that. Our big vulnerability will always be if we have large numbers of people who are not vaccinated. So we're getting through the population as quickly as possible, but what all of us as individual citizens need to do is make sure we come forward for our appointment. We owe that to ourselves, but we owe it to each other too. So let's all do our civic duty and get vaccinated as quickly as possible. Secondly, test yourself regularly. Lateral flow devices, you can order them through NHS Inform. You can get them from local community pharmacies now, or some of the pop-in testing centres, the local testing centres that are available. But if we all test ourselves regularly, we can pick up more cases and do more to break those chains of transmission. And finally, please stick to the rules wherever you live and keep following the basic hygiene measures. Stay outdoors as much as possible, particularly when the weather is as nice as it has been for Scotland in the last couple of weeks. But if you're meeting indoors, take extra care. Stick to the limits and follow all of the advice around hygiene and ventilation. And just remember, physical distancing, hand washing, face coverings, all of these things are as important now as ever, and more important as we are doing more and more normal things. So let's keep doing all of these things, and notwithstanding the case numbers that we're seeing right now, we do have every reason, because of the vaccination, to feel much more optimistic and positive about the weeks and the months that lie ahead. So thank you for bearing with me through that and listening. We'll move straight to questions now, and Jason will, as I say, help me with the answers to these. So first up, Laura Alderman from STV.
Thank you, First Minister. The daily cases that we're seeing at the minute appear to be broadly similar with what we saw back in December when the Alpha variant was circulating, and of course there was tougher restrictions. Now we have the vaccine, things are different, but it seems like the Delta variant, cases of that are soaring. I think the latest data today from Public Health England shows that there's been a 78% rise of those cases in just 1 week. Given that there's thousands of Scotland football fans in London at the minute, how worried should we be, and could tougher restrictions be on the way? How alarming are these figures?
So we should never be complacent about rising case numbers. That's the first point I want to make, because even people who don't end up in intensive care and die, they might still get ill, and we know long COVID, particularly amongst young people, is a real issue. So let's not be complacent about case numbers. And in terms of the rise in case numbers, the Delta variant is the key driver there. The Delta variant now accounts for the vast majority of all new cases being identified in Scotland. And we know it is, I think, about 60% potentially more transmissible than even the Kent variant, which itself was more transmissible than what we faced last year. That said, we know that a rise in case numbers today is not resulting so far in the same burden of illness as a similar rise in case numbers would have done last year or even over Christmas. And the reason for that is vaccination. Vaccination hasn't broken the link between cases and ill health, but it is weakening that link. So the statistic I cited earlier on, back in February, of all the positive cases, about 13% were being admitted to hospital. That's now down to 5%. We also think that people who are being admitted to hospital, and I think we can see this, hospital admissions are rising, but the overall number in hospital at any one time goes up a bit one day, down a bit the next day, staying a bit higher, but not shooting up. Now, what that is telling us, together with the anecdotal evidence from clinicians on the front line, is that people who are being admitted to hospital are not staying in hospital for as long as they were. So all of that is good. And that is why, frankly, case numbers like the ones we have today, at any previous point in this pandemic, were putting us into strict lockdown. The fact that we're not having to do that right now, we've still got restrictions in place, we've paused the route map a bit, but we're not in anything like full lockdown right now. So that is real progress. I really hope we don't have to impose any tougher restrictions. What I hope will be the worst we face is a slowing down of our exit from restrictions, but I am still hopeful that we will get back to something much closer to normality over the course of this summer. In terms of the Tartan Army in London, look, the virus doesn't care about football. It's not going to give you a free pass because you're there celebrating a football match. I don't want to sound like the killjoy in all of this. I'm looking forward to watching the match tonight, just like everybody else is. Please be careful though, and if you've travelled to London, I'd say two things. Be respectful to our hosts in London. Don't behave in a way that's going to make their COVID problem worse over the next few weeks. We've all got an obligation to each other here, and try not to behave in a way that might raise the risk of you bringing the virus back home to your own loved ones. So enjoy the match, enjoy the occasion. We're all hoping for a good outcome to the match tonight. But please be careful and be safe and follow all the rules. And when you're in London, follow all the rules that you've been asked to follow in London, and be respectful to our hosts in London, whether that's pubs or the population more generally. Remember, the Tartan Army were your guests in London at the moment, so make sure you behave in a way that shows the Tartan Army at its best. So enjoy, but please try to be as safe as possible and behave in the way that we know the Tartan Army always likes to do. Jason, do you want to add?
I think you've covered it, First Minister. So we've got things going in one direction and things pushing in the other. So we've got cases and Delta variant up. The 78% you quote is the proportion of Delta cases. It's not that cases have increased by 78%. In fact, if you look at this week, although there's been bumps and ups and downs along the road, we're at around 1,000 cases a day, roughly. Today's a bit below. Yesterday was a bit above. We haven't seen 2,000, 4,000 week on week. So vaccination is helping with transmission as well as helping with breaking the chain of hospitalisations, ICU and death. But remember, 5% of a big number is still a big number. So we can't just let it go. And that's why the First Minister's absolutely right, that the public health advice is just to be cautious at this stage until we get more and more people vaccinated for that second time. Every 10 days allows us to do around 200 to 300,000 extra second doses. So that allows us to get more people protected as we think about relaxing into the summer. And my advice to the Tartan Army and those watching here is exactly the same as the First Minister's. I don't suppose the Tartan Army in London are watching us right now, but if you have any influence over them from here, then just tell them to be as cautious as they can be, and I hope and wish Scotland all the very best too.
Thanks. Ian McInnes from BBC.
Good afternoon, First Minister. Yeah, we're all looking forward to tonight's match and hoping for a good result. But as we were just saying, the scenes of fans seemingly ignoring the COVID rules, those who are following the rules are frustrated by what they see. Is it time to look again at some of these rules when so many people seem to be breaking them? And secondly, if I may, while most fans are obviously enjoying themselves, behaving themselves, I just wonder if you're able to comment on some of the footage being shared on social media, seemingly showing anti-English chants in some of the videos ahead of the match.
Can I take that point on straight away? I've not seen that on social media. I'm not questioning that it is there. I would abhor and condemn unreservedly any anti-English chants, just as we would not, as Scots, want to hear that coming from fans of any other country about us. Racism, xenophobia, anything like that, whether it's in a football context or in life generally, is not to be tolerated. Scotland-England football rivalry is one of the oldest in the world. We'll all be really passionate about that match tonight. I think one of the special moments of it will be before the kick-off, when players from both teams unite in solidarity against racism, and I think that will be a special moment that will send a really, really positive message around the world. But as soon as the kick-off whistle goes, those two teams will be the fiercest of opponents. That's fine. Football rivalry is something that many, many people enjoy, but that should never, ever, ever transfer into racism, anti-English sentiment in any way, shape or form. The Tartan Army has got a brilliant reputation across the world for being, amongst the friendliest travelling support. We all feel proud. I'm talking outside of COVID here, I'll come back to that in a second, but we all are used to feeling proud of watching the Tartan Army bring the colour and the vibrancy to places around the world. It's a long time since we've been able to do it in a major tournament. So to the Tartan Army, Jason's right, they will not be watching right now, but anybody who's in touch, make sure that you behave in a way that does Scotland proud, just as we want the team on the pitch at Wembley tonight to do Scotland proud. And so you've got a big responsibility on behalf of your country, just as our players under Steve and Andy have on the pitch. Look, on the rules, I've stood here until very recently, almost every day for more than a year, trying to encourage and persuade people to follow rules, and the vast majority of people have. The frustration with these rules grows with every day that passes, and the frustration gets more intense, understandably, and I share this, if people who are following the rules think that others are not and getting away with it. I think as we come out of these restrictions, and the same was true last year, it gets harder because there can be apparent inconsistencies. Now, sometimes it will be because we have got inconsistencies, because we've got something wrong and we need to fix it. At other times, there will be perfectly rational explanations for why one thing's allowed and another isn't. But it frustrates people. But I know what frustrates people more than anything is a sense that some people are not abiding by the rules in the way the majority are. The advice was clear to the Tartan Army, not to go to London if you didn't have a ticket for the match. Some people have travelled to London, and that is a decision they've taken. My advice then has to reflect that situation and behave yourselves in a way that minimises the COVID risk, that abides by all of the rules and regulations that are in place in London, and keeps yourself and others safe. And as I said a moment ago, be the ambassadors for the country that the Tartan Army has been so often in the past. Alan Smith from Bauer.
Thank you, First Minister. In your update on Tuesday, you said you were aware of the perceived anomalies that have arisen as a result of the restrictions being eased. Could you expand a bit more on where you understand these anomalies to be? And secondly, if I may, Radio Clyde has spoken with Jeff Ellis of DF Concerts, who says that the industry, events and festivals, need guidance very, very soon, and they need a date to work towards. So in your updated framework that you're publishing on Tuesday, will festivals and events get those dates and that guidance?
Well, events have a bit of that already. I understand the difficulty, but in each level we have set out the numbers that are allowed at events without any further permission, and then also a process that larger events can go through if they want to, what we call the gateway process, if they want to get permission for bigger events. That's what has happened with the Euros, the British Lions next weekend, the same thing. So there is, I would counter the point that there is no clarity at all for the event sector. We want there to be more, which is why what we will set out on Tuesday, which starts to look beyond level 0 to the point where things are much, much more normal even than they will be or are for the island right now in that level 0 category. We have to do this carefully, we have to do it safely, we have to have in our minds the progress of the vaccination programme so that we're not allowing the virus to get ahead of the vaccination. But we can see, and it's one of the things that I know causes people frustration, because they think, well, why can fans be in Glasgow Green celebrating football while other things are still restricted? It's because we have a process for allowing certain events to go forward if they can be demonstrated that they are, nothing's 100% safe, but if they are safe and highly regulated. The frustration, I think, comes from many of the contacts I've had in the last couple of weeks will be, why can I not go to see my child, have its graduation ceremony from nursery, but football fans can gather? And that actually is a really, on the face of it, difficult distinction to understand. And I've spent a lot of time trying to understand it, because the clinical advice to me and ministers is very clear that these childcare events shouldn't go ahead, because we know that if there are outbreaks in education, childcare settings, the knock-on effect then of children and teachers having to self-isolate and establishments being closed is quite significant. And early years establishments, of course, run in many cases right through the summer. Whereas the fan zone, which it's not that football has been given special treatment, it's we recognise that people are going to watch football and they're going to to enjoy the Euros, whatever I say and whatever Jason says, and therefore that is a way of trying to provide an environment for some fans that is highly regulated and is likely to be safer than, for example, people gathering together inside somebody's house. So none of this is perfect. None of this is easy. We will absolutely try to iron out any genuine inconsistencies, and I will try to explain why certain other things may appear inconsistent, but actually there's a rational explanation. But the frustration of all of this is one of the reasons why I am as desperate as anybody to get to the point where we really don't have any meaningful restrictions of this nature at all, and where actually we might still have to, wear face coverings and wash our hands more often, things like that, but we're not being restricted in how we go about our everyday lives. I do still hope that day is not too far off, but this phase of getting there is a tricky one, and we've just got to make sure we're doing it as carefully as we can. Katrine Bussey from PA.
Hello, First Minister. I wanted to ask today about the vaccine programme, which I think everybody would agree has been a really great success, and yourself and Professor Leitch have been talking about how it's breaking the links of transmission and reducing hospital numbers, all these things. But there were figures from Public Health Scotland yesterday showing that almost 400,000 Scots had missed their first jab. They'd had an appointment, not attended for whatever reason, and hadn't rearranged it. And about 20,000 people have missed their appointment similarly for their second jab. As Scotland sort of emerges from restrictions, and as you talk about moving towards more normality, how could that impact on the journey out of lockdown?
Well, our overall vaccination rates are very, very good, and particularly in some of the older age groups, we have uptake rates that are way beyond anything we expected. In some of these older groups, the frailer groups like care home residents and staff, we've got virtually close to 100% uptake. That's way beyond I would have anticipated. So that's the first positive point to make. The second point to make is our vaccination rates are broadly in line with all the other countries of the UK. So what we're seeing, Public Health Scotland has started to publish these do not attend figures, but we'll be seeing proportionately a similar feature in all of the vaccination programmes in different countries. So it's not something that will be in any way unique to Scotland or a situation where we're in any way out of kilter. But, it comes down to what I said earlier on. This vaccination programme is so important to get us back to normality. And the more people are vaccinated, the more normality we'll be able to get back. So literally every single person who gets vaccinated is a wee step on that road. And I suppose the counter to that is every person who's choosing not to get vaccinated for whatever reason is a step we're not taking. And I think it's important to see it as that individual responsibility to the greater good. My responsibility as leader of the government is to make sure we are providing the appointments, that we are getting those appointments to people as quickly as possible. I cannot force somebody to turn up for an appointment. I can stand here and plead with you, and I'll do that for as long as it takes. We'll think about how we make it more flexible. We're already, making drop-in clinics available. We're looking ahead because this vaccination programme is likely to be one we have to do regularly. How do we make the booking system more accessible and flexible? So we've got a responsibility to make it as easy for you as possible. But that final step has to be the individuals of actually turning up to get the vaccination. The vast majority are doing that. But if you have had an appointment that you haven't turned up for whatever reason, it's not too late to go back and book a fresh appointment. And if you do that, you're playing your part in getting us all back to normal. Media, if I may say so, I think does help with this and getting these messages out there. And I would encourage as much of a sort of national collective effort to encourage everybody who's eligible for this vaccination to get it. And the more of us who do, the more normality we'll get back and the more quickly we'll get there. Jason, do you want to add?
Only that we've tried as much as we can to reach groups who haven't come forward with literature, with advice, with Q&As around vaccine hesitancy. And that's really gone down very well, from care homes initially now to some of the communities in the south of Glasgow who the percentages weren't quite as high as the rest of the country and now are doing very, very well. We've tried to take the vaccine to where people are. Your big number of 400,000 is, of course, over a long period, and many of them will have now come to our drop-in clinics, the catch-up clinics, to help us get back to normal. And the overall percentage in each of those age groups suggests that we're picking up a load of them. The First Minister is right, though. The key message is if you haven't come for your first dose, for whatever reason, I really don't care why you didn't come, you can come now. And once you get an appointment for your second dose, please come for that, because for the Delta variant in particular, your second dose is absolutely crucial.
Jason had his second dose yesterday. He is manfully resisting any temptation for kind of man flu type symptoms. He's fine, as I keep telling him. But the second dose is really important, so please don't forget to come for your second dose. The first dose gives you a little bit of protection, but it's the second dose that makes the difference. Dan Vevers from The Sun.
Thank you, First Minister. I don't know if you're working from the same figures, but Public Health England stats we just looked at show Salford has 333 cases per 100,000 for the week ending June 13th, and Manchester 329. Now, these are on the same levels of say, Dundee. So is this travel ban really necessary and proportionate, especially given what you said today about hospitalisations not rising? And secondly, if I may, there was some talk a few weeks ago, and I believe the government has been in discussion with hospitality groups about this, on the 10:30 p.m. closing time for pubs at level 2, particularly regarding Euro 2020 knockout matches in the event they go to extra time and penalties. Can you give us any update on that, or are you waiting to see if Scotland progress?
No, we're not waiting to see Scotland progress. I suspect people will still want to watch the football even if Scotland doesn't progress, but we hope Scotland does progress, so let's not jinx it by talking too much more about that right now. We are considering that, and when we have an update, we'll give that, obviously. The reason that the cut-off times are there for opening, it's for a reason, but of course, there's a need as well to balance pragmatic considerations and to avoid unintended consequences, so we'll give an update on that in due course. And in answer to your first point, we have a legal obligation to act in a proportionate way. So all of that is taken into account. Nobody wants travel restrictions. Nobody wants them to be in place longer than is necessary. We've actually lifted some today, and we continue to take those decisions on the basis of assessments of necessity and proportionality. Michael Blackley from the Daily Mail.
Hi, good afternoon, First Minister. You talked earlier on a little about hospitalisation figures, and the latest Scottish Government modelling the pandemic report, which was released today, says that the forecast for later this month and early July for hospitalisations and ICU is actually lower than was first forecast. Does that give you a lot of optimism that we will definitely take the next step out of lockdown in July? And is there any prospect at all that it could be any earlier than July the 19th? There is some talk south of the border of possibly as early as July the 5th for the next step there. Is that a possibility here?
Look, I'm not going to get sort of distracted by media speculation about what might happen in England. I've said all along we will try to do what's right for Scotland. I got lots of grief, probably including from you and your colleagues, Michael, legitimately for not, sort of agreeing to the 21st of June Freedom Day back when it was announced for England, because I just didn't think at that point it was possible to do that. And as it turns out, it hasn't been possible to do that. So I think it's important that we consider this on the basis of all of the evidence we have, that we don't try to get too far ahead of where the evidence allows us to make judgments. So I very much hope that over this summer we will pick up the route map again and get back to where we always wanted to be, even before we had to pause it. And I'm optimistic about that. Will I use the word definitely right now? No, because if I was able to use the word definitely, then I wouldn't have to wait for 3 weeks to assess the evidence. I'm not going to give people false promises, much as I would love to stand here and give certainty about the 19th of July, not least because it's my birthday, so it would be good if it was the day I was able to sort of take away all restrictions, but I can't do that right now. But we will take it step by step, and I'm optimistic. And actually, one of the reasons I'm optimistic is the data you cited at the start of your question. Jason will correct me if I'm getting any of this wrong, but I'm going to generalise here. At every stage, I think, since the Delta variant started to drive this latest wave, the actual hospitalisation figures have been below what our forecasts would have expected. So that's really positive, and if that continues to be the case, then yes, that will make us even more optimistic about our ability to get back to normal, and perhaps even get to that normality not much different to when we might previously have hoped, even although the journey to it has been a bit up and down. But we just have to allow this evidence to develop and monitor it as carefully and as regularly as we can. Do you want to add?
You're absolutely right, Michael and First Minister, that the modelling, the most recent modelling is relatively encouraging. It still suggests hospitalisations will rise. As cases rise, hospitalisations rise. They appear to be younger, which makes perfect sense. They appear to be staying in hospital for less time. Again, that makes perfect sense. And not as many progressing to intensive care or, unfortunately, to death. So that's all good. But remember, big numbers will still cause that to be a challenge. And our hospitals have remobilised to a great extent. We don't have hundreds of empty beds like we did in wave 1 ready for COVID. So we're now doing much more elective surgery. The health service is starting to gear up again. So we have to be cautious, and that's why the First Minister is correct, that the advice she's getting is about caution and not definite dates.
Ailsa Mishman from the Scotsman.
Thanks, First Minister. One maybe for Professor Leitch on the Tartan Army. Other than potentially increased case numbers, are there any particular reasons for concern about people coming back from London to Scotland in terms of the proportion of the Delta variant or any other variants? Are there any things that are different in London that are down compared to up here? And secondly, on vaccines, Humza Yousaf wrote to Matt Hancock last week asking if more could be done to accelerate Pfizer supply. Has anything come of that? And finally, just a quick clarification. You said you'd aim for all doses, all first doses to be given by July 18th. Can we just add 8 weeks to that and say September 12th for all second doses?
I'll come back to the vaccine points, both of them, but I'll let Jason answer the the Tartan Army point.
So London is actually quite similar to Scotland. It has, last time I looked certainly, it had quite a lot of variation amongst its boroughs. So it had some places with high concentrations of community transmission and other areas, just like in Scotland, with relatively low areas of transmission. So in the round, I think London looks a bit like Scotland, but London is very densely packed. If you go indoors, if you break the rules of numbers in London, in Scotland, you are much more likely to have the virus. And remember, people are travelling, car sharing, buses, trains, again, risky areas that you've seen us make guidelines about over the last months and a year or so. So we're concerned, but if people follow the rules, if they stay outdoors, if they wash their hands, if they stay away from big crowds, then I'm hopeful that we won't see either virus increasing in London, which is problem number one, but also virus increasing when those individuals come back home.
And on your 2 points about vaccine, your second one very perceptive, and I'll come to that directly in a minute. So we're discussing with the UK government and the other nations, as we do on an ongoing basis, how we make sure we're maximising the supplies that come forward. So it's not about, as a result of that letter, suddenly we were miraculously going to have lots more Pfizer supply. It's about how we work together on an ongoing basis to maximise that. And that is increasingly important for all of us right now, because as we get into the younger age groups, which we're not giving AstraZeneca to, so the reliance on the Pfizer supply becomes all the greater. And that's where over the next few weeks, supplies may be more constrained as well. So it's just about making sure that we're all working in a way that is maximising the throughput of that, so that we can meet the deadlines that we are setting. We're confident now we can meet the 18th of July for giving all doses or to all adults. And yes, you're right. So 8 weeks from that takes us to sort of mid-September, which is when we would hope that we will be on track to complete second doses. The caveat I've got to put in there is that is dependent on us having the supply to do that. But we are wanting to give second doses 8 weeks after first doses. So if we're going to complete first doses by the middle of July, then 8 weeks after that is when, all things permitting, we would hope thereabouts to be completing second doses as well. Tom Martin from the Daily Express.
Hi, thank you. It's just a very brief follow-up on this issue. Are you further ahead than anticipated in delivering second doses? Is it going faster than was previously envisaged?
We're further ahead than we anticipated in first doses. I think we're probably broadly on track with second doses, but we are now reducing the gap from 12 to 8 weeks. So we will be speeding up with second doses as well. But the programme overall is definitely ahead of where we might have hoped it would be some weeks ago. So everything on the vaccine programme is good news. Everything on the vaccine programme is on the upside. We need to get it completed as quickly as possible. But that's the positive stuff. It's the virus continuing to learn how to run faster that is continuing to cause us the problems. Dan Sanderson from The Telegraph.
Thanks, First Minister. Can I just ask you to say a bit more about your response to Dan from the Sun's question? The modelling from the Scottish Government suggests that Dundee has a 75 to 100% probability of soon exceeding 500 cases per 100,000. The rates currently are almost identical to Manchester and Salford. So Could you just explain a bit more about why it's necessary to bring in restrictions there, but not for Dundee? And also, given what you said to Alan about the fan park and the benefits of that in Scotland, do you think it was a mistake that there isn't a sort of similar facility where Scotland fans can safely watch the game in London? Thanks.
I have got enough on my plate taking decisions for Scotland. I'm not going to start to second guess decisions for London. Those are for others to take, and everybody's trying to take the best decisions possible there. If I've got a responsibility at all for London this evening, it is to do what I can to encourage the Tartan Army to enjoy themselves, but to behave responsibly in every sense of that, and that's what I've been doing today. Look, we take decisions on the basis of risk and relative risk. We've got the level system in Scotland that determines whether and when travel restrictions are imposed within Scotland. This is not, I don't want to be imposing travel restrictions anywhere. We're doing this because, advised by clinicians, we make assessments of how to minimise the risk of more virus coming into Scotland or people travelling from Scotland exacerbating the situation elsewhere. And as you see today, we don't keep them in place for any longer than is necessary. Caroline Wilson from the Herald. Is Caroline there? I'm not hearing her just now, so I'll try again in a moment. Tom Magner from Carers World Radio.
Thank you very much indeed, First Minister. A wider question, if I may. Our unpaid care reviewers are calling increasingly for health and social care to be much more joined up. In fact, ideally to be seamless at the point of need. How close is the working relationship between the two in Scotland, particularly under the unforgiving pressure of COVID-19? And in light of that, I'm keen to hear from you both on the question, can health and social care work together in perfect harmony? If not, why not? Thank you.
Well, it should, because health and social care services are looking after the same people, often at different times, and people are single, whole people, so the services that cater for them have to be equally joined up and coherent. In Scotland, of course, we have integrated joint boards, so we've already had a process of integration of health and social care, which I think means that relationship is much closer now than it used to be. I think back to 2007 when I first became Health Secretary, it was much, much further apart than it is today. But there is still more to do, which is why, of course, we are now in the early stages of a national care service, which will, I think, further, it's not just about that integration, but it will further help that process of integration. But making sure those services are fully joined up is absolutely essential, because people require that, and it's catering for the needs of people that is most important. Caroline Wilson, I'll give another chance to. Okay, I'm not, I don't know whether it's our technology or another issue. That concludes the questions today, so my thanks firstly to the journalists who've joined us, to Jason, to Anna for our BCL interpretation, and to everybody watching at home. Please do all the things that we all know we need to do to get us out of this, get vaccinated, get tested regularly, and just follow all of the rules in place and all of the public health guidance. If we all do that, there's lots, notwithstanding the rise in cases over recent weeks, there's lots for us to feel optimistic about tonight. And on that note of optimism, good luck Scotland. Come on, let's get it done at Wembley this evening. So to Steve, Andy, all the boys, best of luck. Thank you very much.